Michael Hales, thank you so much for your time today. So
Happy to
you've
be here.
been Medicaid director for 9 years.
Yes.
What sort of challenges, if that you see really facing you in this area? You've been there quite a long time, so you have quite a bit of perspective.
Yes, in Medicaid every year when you're asking the legislature for money for growth in the costs of care or the number of people coming on the program, you recognize that there's tremendous pressure on legislators to find ways to control or contain costs in the Medicaid program. And within Utah Medicaid, as we were working with our legislative leadership several years ago, we thought if we could allow the cost of Medicaid to grow closer to the rate of the general fund growth rate and view it as a sustainable part of the state budget, then everyone would feel comfortable committing to the care of the lower income population and the needy in the state, as well as meeting some of the budget objectives. So that was one of the primary goals of the reform.
Okay. We've just heard from your colleague over at Intermountain Healthcare that the transition has been relatively smooth. I mean, would you agree that this is one of the most dramatic changes to the Medicaid system you've seen during your time in office there?
Yes, it was a substantial amount of effort and change. We tried to be very deliberate in planning the waiver and negotiating with the federal government and CMS and what those reforms would look like, and then took close to a year with the health plans and our programmers to get our systems and infrastructure in place for the reform. But I think with good planning and preparation and everybody being engaged with all the important stakeholders, both the clients as well as the providers, that we were able to make a successful change January 2013 when we started this, and we've had it running for a little over 2 years. I like to tell people there are still reforms taking place within the reforms as those who are involved in the provider community are learning more about where we're at today, and we'll expect those reforms to continue.
So with all the dramatic changes going on, what is the customer experience like on the ground?
Well, we were very mindful of this as we started these reforms, recognizing anytime you change the payment and delivery system model, there can be perverse incentives that could negatively impact clients. So we had some good historical data to manage or monitor the experience of clients in the Medicaid program leading up to the reform. We continue to use those same quality measures, both on the quality of care as well as the client experience measures. And after the first year's data has come in, it's shown that they've been at least as happy, if not happier, with the new reform.
And why do you think the reviews are so good?
Well, I think in general they feel like we're listening to their needs and we're trying to help them get access to the providers, or at least put them in touch with the appropriate providers, where in a previous model they may have been left navigating the system on their own.
Okay. What can be learned from what's going on in Utah? Other states are trying desperately to find good, solid systems that they can work with, and it seems like you've learned quite a lot in the last 2 years. What is the message that you want to send to other states?
Well, I think, as you mentioned, every state's experience is going to be a little different. So if any state can look at our model, look at the underlying dynamics of our marketplace, see what the prevailing market structure is in their state, look at our reforms with the goal of trying to set a sustainable target for long-term growth and giving the provider community some predictability in their revenues and a commitment to balanced growth going forward. Those were some of the underlying principles that we think can be leveraged in any state.
Okay, great. Is there anything that I've missed, Mike, that you'd like to add?
Well, I think that's a pretty good summary. There's a lot of details to it, but if we can get people interested in exploring it and working with us to see how it might be adaptable to their states, we'd be happy to help them.
Okay, great.
Thank you.
Thank you so much.